Hello, welcome to my presentation. I'd like to start off by saying that as people, we desire control, clarity, and peace during times of difficulties when the mind just won't stop running. Thoughts and perception of self are what defines a person. One of the ways to get closer to the inner self is through meditation. Higher education students should practice meditation. So my paper is based on impact of meditation on higher level academic performance. This thesis statement is higher education students should practice meditation because it positively impacts attention problems, stress levels, and mental health issues, leading to better academic performance. Meditation has its origins from all over the world. Therefore, different forms of this practice vary from each other. Some types of meditation are mindfulness, breathing focused, body scanning, Zen meditation, chakra meditation, etc. Different forms have different effects, but the common elements between most forms of meditation are limiting distractions, keeping an open mind, relaxing, staying still, and focusing on the self. The mind, it is a wanderer. Many students have problem with attention and memory retention, but meditation helps them improve and enhance these factors. A human brain is easily distracted, and young adults have a lot running through their minds all the time. Focusing and concentrating on academics consistently makes it difficult at times, especially during the era of digitization when distraction and dopamine release are just a click away. Meditation helps learning, processing, and retaining information properly and clearly. Mindfulness is an inclusive, deeper reaching function which goes beyond concentration and watches with a broad focus, quick to notice any changes that occurs. This form of meditation helps bring the wandering mind back to the present moment. One can learn to untangle the jumbled thought processes, understand them, and slowly learn to control or simply ignore the distractions when needed. Meditation also helps retaining information more easily. Researchers have proven that it reduces inattentional blindness, which means, just missing things in plain sight, and it also helps us encode information better. Students also have to deal with a lot of stress during their college life. Alongside students' academics and career development, they also have to deal with personal stress, which can include relationships, sense of values, religion, financial problems, or any other factors. The stress leads to increase in cortisol, the stress hormone which impairs brain functioning. Even though normal levels of cortisol hormone help with decision making, memory, and other factors, high levels can have very negative effects on the brain and its functioning. Stress also causes decrease in oxygen and blood flow. These factors can further cause mental illnesses, cardiovascular diseases, and in some critical cases, even suicide. But meditation helps us reevaluate and dissect the stressors. It helps with clarity and relaxation. Focused breathing meditation's goal is to focus attention and produce a special state of consciousness. During this state, one removes all thoughts which lead to fear and anxiety, pressures and distractions, and only focuses on the breathing pattern. An example is Buddhist Anapanasati meditation, a form of breathing meditation which has been proven to release stress and improve academic performance. On the other hand, if stress on a day to day basis is not handled properly, it can lead to severe mental disorders like anxiety and depression. Many students are known to have these disorders, which lead to poor academic performance. Some other mental health disorders students have are PTSD, bipolar disorder, addiction, etc. These can be caused by traumatic past events, loss of self control, and numerous other factors. Meditation has been used as a behavior therapy which emphasizes on changing the function rather than the form of behavior, cognition, and emotion. It includes mindfulness based stress reduction, cognitive acceptance, dialectal, and many other types of therapy. Regarding meditation, transcendental and mantra meditation have been proven to be effective for patients with post traumatic stress disorder. The patients can slowly get relief from internal pain, intrusion, and avoidance. The skills help them breathe calmer and better emotional processing. Loving kindness meditation, a Buddhist form of meditation, has been implemented in both depression and schizophrenia during teenage and young adulthood. Students are more prone to substance abuse, which may lead to addiction. During this time of freedom, experimentation, transition, and stress, higher education students are most likely to abuse substances. Addiction to substances such as cigarettes, alcohol, marijuana, cocaine, or any other psychedelic drugs is very harmful for their long term mental, emotional, and physical well being, which also affects their academics. However, practicing meditation can help with addiction disorders too. Mindful breathing, as well as acceptance and commitment meditation practice, helps with craving and withdrawal symptoms in nicotine deprived smokers and even hard drug abusers. Consistent practice also reduces the risk of relapse. In conclusion, meditation helps university level students improve their academic performance by helping with problems such as attention, stress, mental health disorders. It helps with inner peace, calmness, relaxation, and overall day to day functioning. By practicing meditation constantly, one can improve their ability to focus and also helps with attention disorders such as memory retention. Students also have to deal with a lot of stress academically and personally. However, meditations like mindfulness, breathing focused, body scanning, etc., can help them relax and be more aware of their thought process. Stress, as well as numerous other factors, can lead to poor mental health. Mental health disorders such as anxiety, depression, OCD, PTSD can arise at any point in life and can heavily impact a student's academics. It has been proven that practicing different forms of meditation can help reduce severe symptoms of mental illness and withdrawal in students. The chances of relapse also reduces significantly. Therefore, higher level students should practice meditation and benefit from the results. I'll be happy to answer any of your questions.